Hello everyone, here we'll try to learn about the neuromuscular blockers. So neuromuscular blockers can be classified into presynaptic blockers and postsynaptic blockers. So this is a diagram of neuromuscular junction with their receptors, that is nicotinic receptors. Presynaptic blockers are botulinum and hemicolin. Botulinum, it mainly blocks the docking proteins of the vesicles, and hence it will not release acetylcholine. So these are synaptobrevin and syntaxin. And hemicolin, it blocks the uptake of choline back into the presynaptic membrane, and thus it acts as a neuromuscular blocker. Postsynaptic blockers are classified into competitive blockers and non-competitive. They are also called as depolarizing blockers. The competitive blockers are curers and galamine. So these are the substances which compete with acetylcholine for receptor binding, and thus they block the neuromuscular junction. Whereas non-competitive or depolarizing blockers, they can be acetylcholine mimicking drugs, and they can be acetylcholine esterase inhibitors. Some of the substances like succinyl CoA, they are resistant to the action of acetylcholine esterases. So continuously they lead depolarization and paralysis of the muscles, and thus they act as a neuromuscular blockers. Whereas acetylcholine esterase inhibitors, they inhibit this particular enzyme so that acetylcholine is not broken, and it continuously depolarizes and paralyze and cause paralysis of the muscle, and thus acts as a neuromuscular blocker. So these can be irreversible blockers, or there can be reversible blockers. So reversible blockers are neostigmine and physostigmine, whereas irreversible blockers are like organophosphorus compounds like malathion and parathion.